Yes.
I'll make this quick. I do have a question at the end, but I just want to say that my experience with healthcare was that I was contributing to the society or working, and I never was able to cover myself and my kids until I was into my 40s. It was either I could be covered or they had the payments for them, premiums for them was so high, I had to go look for it. And when I went to look for it, because I took my son to the doctor once about depression, it was a pre-existing thing and they would cover for 6 months. So for 6 months I was like, don't play outside, just so that he could, I didn't have to worry about taking him. I've also had my wages garnished because of having to go to the emergency room or having to pay medical bills. So, and I was working it full time, and I went back to school so I could make a better wage. So when I heard about the healthcare reform, and I have really good insurance now, that covers my kids, for a second I was like, oh no, is it going to affect what I have? Because I worked really hard to get to this. And then I thought, well, no. I looked into it and no. But I also thought if I had to pay a teeny bit more so that some other kids could be covered when mine weren't, I was really willing to do that, if that's what it was. My oldest son, who went to school and is now getting a job, is not insured. And we can't afford insurance. And so I keep telling him, hold on. So I guess my question is, if this does pass, how long is it really going to take to implement it? Because, when they did the credit card thing, they were like, well, it'll be done in 18, they were telling me what the percentages. They said, well, in 18 months, you'll see a relief from this. Is this something that, if we do get a pass, it's going to be like a year or two before it really kind of...
Right. Well, on the credit card thing, that, to me, it should have just gone into effect right away. They've been abusing a lot of people for a lot of years. And what they're doing is they're using this interim period to jack up people's rates and do other things in the interim, or cut, or take away your credit cards or whatever. So, healthcare, that part is not settled yet. What parts would go into effect? How quickly? That's part of the debate here. How quickly can we make some of these changes? That's not resolved yet, but and are there things we could do in the interim within the existing system before those things become available to help people? But you're right. If there's a kid today who doesn't get treatment and ends up with a lifelong problem, one extra day is too much. So if we need to have a sense of urgency, but we've got to get it right, and we've got to see maybe there's some interim steps before some of these things go fully into effect. So thanks for that. That was an inspiring story. I'm going to do 3 more, 782, 825, and 460. There's one gentleman over there with the UO hat on in the middle of the aisle. It is an Oregon hat, isn't it? Green. It's got an aura.
Thank you, Mr. DeFazio. I hope I don't crowd this mic too much. I've got a couple of questions to ask you. I'd like to get an answer, yes or no, and before we start, I would like to make a comment. This does pertain to health care. I was in the hospital 3 weeks ago, 4 doctors, one-on-one. I asked them the same question that I'm going to ask you. All 4 doctors did not know. Lane County Tax told me that 90% of the people in Lane County, the state of Oregon, and the United States didn't know the question. The question is, Mr. DeFazio, do you know what a personal lien is?
Well, I think...
Yes or no, sir, if you would, I'll finish.